Once we understand what forward head posture actually is and represents within the body, the chin tuck exercise quickly starts to make very little sense and could actually be counterintuitive to what we actually want to accomplish. Now, this exercise could have benefits in some limited capacities depending on individual circumstances, but for the overwhelming majority of people, I think that this exercise does not have a lot of value, and here's why. Let's first appreciate that posture is a representation of our body's ability to manage gravity and our center of mass. Regardless of what postures you look at, whether you're talking about forward head posture, kyphosis, lordosis, all these different things are just representations of our ability to keep an even center of mass and the line going down the midline of the body. We're going to alter our spine curves and the position of our hips and our shoulders and our head to accommodate for that. It's also very important for our cervical spine to have some degree of extension or lordosis to it. That allows us to have this S-shaped curve of our spine where we have lordosis and extension of our low back, a little bit of flexion and kyphosis of our upper back to lordosis here in the cervical spine. So this allows our airway to remain open and so we can breathe. If you try to push your chin back like this, it's very hard to breathe naturally in this position because you're closing off your airway. And if you push your head too far forward, it's also harder to breathe in this position because your airway is going to be restricted. However, if I have a position where my ribs are internally rotated or I can't breathe as well as I want to in a resting state, then what I can do is I can push my head slightly forward over time. And that is going to help me open up my airway a little bit. Now, if I have kyphosis and rounded forward shoulders, you can see how that's gonna push my head more forward. But what is this actually? Well, if my ribs are internally rotated and I have these ribs pulled down into this position, this is a position of exhalation because when we exhale, the ribs need to internally rotate. When we inhale, the ribs need to externally rotate. And our diaphragm should help accommodate that action of inhalation and external rotation of the ribs. However, if I have a position where my ribs are internally rotated and or I have a limited ability to take a breath in during normal resting inhalation, then I am going to need to create a strategy to seek inhalation and the ability to actually breathe, which is obviously very necessary for survival. So what I'll end up doing is I'll push my head forward, and that's going to allow me to take a bigger breath of air in, because what this also does is it helps me get the muscles on the front side of my neck, which normally are secondary assistance muscles of inhalation, such as your scalenes and SCM muscles, which attach more on the front side of the neck. If I push my head forward, not only does that open up my airway, it allows these muscles to gain leverage to create inhalation, which shouldn't be their main job. That should be the diaphragm's job. When the diaphragm is in a compromised position, then these muscles like to work in overdrive. So that was a lot of information, but basically what that means is that when my diaphragm can't do the job to create inhalation and I have depressed ribs that can't normally open up as they should, then I can push my head forward to open up my airway and to use my neck to breathe instead. It's really frustrating for me when people just look at the body and they see something like forward head posture and they go, okay, well, your head's forward, so let's just shove it back, without appreciating why that's happening in the first place. That's such a simplified, overly myopic viewpoint, such a reductionist viewpoint on what we should do to correct what's happening within the body. But it's not necessarily just as simple as pushing our head back. That's going to close off our airway more, and that's not going to solve the root cause of the problem. The issue is twofold. It's a center of mass issue, meaning our pelvis is probably a little too far forward, which means that we're going to have more rounding here, and then our head's going to be pushed forward to accommodate for that line needing to run down the midline of the body. That's one issue. The second is we don't have an ability to actually take a full inhale in as we should in a normal resting state. So we're trying to open up our airway more, and we're trying to create an ability to do that more easily. Now, the first thing we need to do is be able to get the rib cage and the head stacked over the pelvis more effectively. So instead of being in this position with forward pelvis and really rounded shoulders, we need to get here more effectively, which means we need to bring the pelvis back underneath ourselves. Yes, we actually need to address what's going on down here so that all this up here doesn't have a reason to move forward. So here's an exercise you can do to bring the pelvis back underneath yourself and also train better respiration through rib cage movement and the diaphragm. One of the biggest goals of my beginner body restoration program is to restore the ability for us to move into this stacked position of our head over our ribs, over our hips and our pelvis. And we do that through exercises that help restore pelvic mobility and position, rib cage position and mobility, and the ability for the head to also remain in a nice position. And that way we can move in and out of different positions more effectively and we're not just stuck in one. So here's an exercise that gives you a lot of bang for your buck because it's going to teach you to get your pelvis underneath yourself and use the diaphragm to create expansion of the rib cage so that way the head and neck don't have a reason or as much of a reason to be pushed forward in the first place. One exercise that can help address that pelvic position as well as the head position is we can get in this 90-90 position with our feet up against a wall. And we have some support underneath his heels, but you don't need it. It's just really helpful to find and feel the right things. So we're gonna get in this position and we have a towel rolled up enough so that way when he leans back, that head is in a nice, comfortable position where it feels like this towel roll is supporting his head fully, but it's not tipping his chin further back than it would normally be. So it should feel like it's nicely supporting his head and opening his airway a little bit. Now we're gonna take a little ball or something that allows our knees to stay in line with our hips and also our feet. We're gonna keep that right there. Now what we're gonna do is put our hands on our low ribs, and as we gently exhale through our mouth, we're gonna feel both feet flat on the wall, but drag down with the heels. And our low back is gonna stay on the ground, but our tailbone and pelvis is gonna come slightly off. We're gonna feel hamstrings on both sides. Then we're just gonna sit here, breathe in through our nose, out through our mouth. It's a nice long sighing exhale for 8 to 10 seconds. You're gonna feel a little side abs engage. Then inhale through the nose silently. We should not hear you inhale for about 5 seconds. Keep going through that for about 5 to 8 breaths. So now let's talk about what's happening within the neck itself. So we want to get this cervical spine lordosis to a healthy degree, but not so much to where we're shoving our head forward like this. So we want to open up these ribs right here, which will take stress off of the neck because the scalenes and the SCMs attach on the collarbone and these first ribs right here to help try to elevate the rib cage, to open it up. So we want that to happen without needing the neck to do it for us. So here's an exercise you can do that will put the head in a good position and pattern better respiration without needing to shove the head forward. To do this, you can get in this low crab position right here with our knees bent a little bit, our feet flat and in line with our knees and our hips. And what we're gonna do is get our head supported on a wall. So that way we have no tension whatsoever in our neck. Remember, we need to keep the airway open. So it should feel like your head is supported and relaxed, but it's not too far back and it's not too far forward. It should feel like you're easily able to talk and breathe in that position. Now, with our forearms flat on the ground, we're going to gently push into the ground, which is going to push our chest up, but that should not be the same thing as the ribs flaring up. If that happens, your low back is gonna move. We don't want that to happen. Our sternum is just gonna come up as we gently push, and our shoulder blades will come slightly together. So make sure your ribs aren't flaring. There's a difference. Now we're gonna exhale through our mouth, nice and relaxed. Get the air out, get the air out. You're gonna feel a little bit of side abs at the end of that 8 to 10 second soft exhale. Hold that and gently inhale through the nose. Silent inhale, should not hear you inhale. For about 5 seconds, you're gonna feel all this open up. It should feel pretty good. If you wanna get your lower body involved in this too, to get that pelvis to come underneath you a little bit more, then what you can do is grab a couple of dumbbells or something about this length and then put them up against your butt and also your heels. Keep your whole foot flat, but gently drag your heels towards your butt, which is gonna give you your hamstrings on both sides. I would recommend starting with these exercises for about 2 sets of 5 to 10 breath cycles in both the morning and the evening. If you want more information on this sort of issue, I will link exercises at the very end slide of this video coming up right now.